So hello, everyone. My name is Dr. Susan Upham, and I'm part of the educational program for the New England College of OCMed, and we work with MARCOEM also to put on these presentations. Thank you for joining us for today's webinar. It is my honor to present Dr. Kenji Saito, whom many of you know very well. We're really appreciative, Kenji, of your carving out a little bit of time out of your busy schedule to present this to us. Kenji studied bioethics at the University of Pennsylvania before earning dual degrees in medicine and law, and then later completing his residency in preventive and occupational medicine, being the chief resident at the University of Pennsylvania. He is a past president of not only NECOEM, but also ACOM, and he's clearly very passionate about occupational health and wellness and continues to be extremely active in the field across the globe. We always find him in various locales and when we try to connect. He's the president and chief medical and science officer at MedLaw LLC. I want to let you know we will try to carve out some Q&A time at the end of this presentation, so feel free to keep your questions and present them at that time. And with this, I'd like to turn this over to Dr. Saito.
Wonderful. Thank you, Dr. Upham, and thank you, team. It's nice to be back. It's been a while. Actually, I'll be heading up to New England this weekend, hopefully to see some friends and family that I miss up there. Definitely looking to get back to the East Coast. Just actually returned from the Southeast region of Asia, looking at some of the organizations sort of teaming up around occupational health, safety, and looking at some regulatory frameworks. I'll share some of that experiences that I've had around the world. I've had the distinct pleasure and privilege to be able to present the occupational health realm on all the continents, except for Antarctica, working on that right now with our colleagues in Australia and in Argentina. Hopefully that'll be on the bucket list to give one of the first occupational health talks in Antarctica. So with that in mind, there's a lot changing in the world, especially in the past 5 years. Sort of pre-pandemic, there was a sort of innovations around digital health. And then definitely post-pandemic, we're starting to see a lot of people using technology in unique ways, and especially in occupational health. I think we're in an interesting position and opportunity right now to look at the future of work and how that can really impact what we do as a profession, but how do we best protect workers as we look into the future as well. So I have the opportunity to talk about that today. So let's start off with some interesting opportunities to use technology as we talk about it today. As most of you know, I like to teach very psychotically, so I like to ask questions and like to use technology to do that. So if you have your phones or if you're on Zoom or on your computer, if you can go and use that QR code right there, or you can go to pollev.com/medlaw. You could also be able to join me, and we're going to do some live polling. So we're going to see if this is working or not. So as you kind of look at this picture, you kind of think about, is this real? Is this something I actually took on my phone, on my camera? Or is this something that was artificially generated through artificial intelligence? I'm curious to see if our system's working today. So if you're able to pull this up, let me know if you're able to see that. The results, are you able to see the results by any chance? Can anybody see the screen change?
Yes, Kenji, we can see a question. I notice on my cell phone, it wants to know who the presenter is. And when I put Kenji Saito in, I can't really join. Do you have another way for us to sign in?
Yes, let's see here. Let me pull it up. If you try that QR code again now, let's see if that pulls it up. And are you able to bypass the presenter?
So actually, it just brought up this first question that you had up. So
Oh,
as
good.
long as everybody is feeling comfortable with this, I guess we can move on. Thank you.
Okay. Yeah. And are you able to see the changing results though? I'm not sure if that screen is showing. Let me see here.
I've submitted answers, and I think of seeing in the chat we've had some other answers submitted, but it doesn't look like it's updating.
Okay. Give me a second here. I think it's because I had the wrong screen shared. Give me one moment. Sorry, technology is great when it works. When it doesn't, we have to be able to manage. So let me see if I could do this. And let me share my screen again. Let's try it this way this time. And you probably see my presenter mode, or do you see the screen?
Okay, so now we're seeing results, I believe.
Perfect. Wonderful. So most people think this is AI generated. interesting because I actually took this picture with some macro lenses, so I was able to get some really good auto pictures on this, right? We've gotten to the point where now it's really hard to tell, what's real and what's not. So it's quite interesting as we kind of go through this talk. I'll ask these questions again later in a little bit, but hmm. Okay, can you still see my full screen right now? Okay, great. So those are my conflicts. I just want to make sure I disclose that as part of a educational endeavor, but no conflicts directly related to today's talk. So hopefully everybody should be able to see this now. Actually, this is a good test for audio. Can everybody hear the audio? Perfect. So this is me in South Africa, here talking to Johannesburg. And as part of that, the host took me on a nice little safari, just kind of getting the interesting perspective of the country, understanding the culture, but also being able to see the environment they live in. Right? This reminds me why we do not just occupational medicine, but we also do environmental medicine. Right? It's really important to think about how the built environment, the surrounding environment really impacts the way we look at the world, the way we look at workers, and our place in that society and that community really plays an impact on what we can do as a future of work and what we think about how we work in that environment. You look at an urban setting like Tokyo, you kind of see different wildlife. As I had the opportunity to see a lion a couple feet away from my face that roared right at me, taking pictures of the lioness. So learned a lot from that, right? There's a lot of opportunities to be able to see what we do. I had the luxury of swimming in all the oceans on Earth as well, and here with me, free diving with a shark in the Philippines. It was a really good experience to understand sort of what we looked like, and not just in one country, but as a global citizen of Earth. Our responsibilities and occupational health to protecting these workers, the future of what we do, and the environment we in, and the population we serve. It's really different as you kind of look at society in general. How do we tie in the idea of social health, environmental health, mental health into one, the connections that we have with nature, the connections we have with society? And here I am landing in Perth, Australia, on the right after leaving Africa. And I was greeted by a dog, thinking, oh, great, they're going to come and greet me and say hello. But actually, it was a working dog, right? It was an occupation for them. And the customs agent actually came over, asked me if I had anything in my school bag and my backpack. And I was like, well, I was just in Sydney. I had some fruits. She's like, well, no, you can't do that. I'm like, oh, I thought it was the same country. Didn't matter, right? If you're going from one end of the country to the other, especially in Australia, you can't carry that. So we had my first endeavor with a working dog, and I thought about the workplace. I'm like, huh, it's not just humans we work with, right? It's also other animals that we work with as well. I have a lot of accommodation requests coming in now from the workplace around, what do you do with bringing pets to the workplace? Thinking about how that's changed during the pandemic, that the amount of pets owners now have definitely increased. How do we share that with the workplace of the future? How do we share upon the culture, the connections we had, especially in a work environment where most of us are working hybrid, whether it's remote or in person or a combination of both? How do you serve the connections there? How do you serve and connect with people when you're working virtually? Here I am in Ireland, presenting at a replica of the Titanic, and be able to see how people share some of the best practices in Europe and be able to share that stage with the folks and be able to give a talk and remind myself around not only is it going to impact Europe or the European Union, how does it impact the US, Canada, Australia, who has more robust occupational health programs, but how about countries that don't have that opportunity? What are we sharing best practices with countries that are developing occupational health within this decade, within this century, where we've been around at ACOM for over a century now? It's going to be an interesting question. How do we share those best practices with everybody? So that's a good question I like to kind of start at is, are most of us on this conversation right now in this meeting physicians? You can click a thumbs up like social media. And how do we going to frame our talk for today? Do we have any resident physicians on the line, any medical student, nurse practitioner, physician assistants? So it seems like most of us are physicians on the call right now. So I'll see if this is working. So it looks like most of us are there. You can type it in. Of course, we don't want to forget our nursing colleagues, so thank you for joining. I think it's going to be really important. I'm actually giving a talk in Cork, Ireland, in October with the Global Occupational Health Nurses Association. So I'll be looking forward to sharing some of these best practices with our nursing colleagues that develops our occupational health team. So great. What profession were you practicing before you started the practice of occupational health? You can either type your answers in, you can click a thumbs up if you've practiced one of these before. I think this is always interesting, right? And I just thought this was a US concern, but it actually is a global concern. A lot of us actually start in other professions and didn't know about occupational health. and came into this role. And I think there's a role we play now, whether as an organization such as ACOM, MARCOM, or NECOM. How do we promote our practice into the future? Is it going to be something that's a specialty service? Is it something that's combined with public health or primary care? I have a lot of colleagues who sweat a switch from surgery or left from preventive medicine over to Occ Health. So it's a good idea to see, where we all came from. Acute care, maybe like urgent cares. We have some partnerships now with different urgent care centers serving and practicing occupational medicine. It'd be interesting to see how we can expand those services a little bit better. But it'd be interesting to see, and I'll come back to this in a little bit, because where we came from is usually how we practice, but it'd be nice to really develop new programs. If you look at the Gulf region, Middle East, some of the Southeast Asia region, I'll share with you in a little bit. This is new for them, right? So they get to look at it and create a program de novo. They get to take the best of all the worlds that has occupational health for the past decade or past century and be able to build their own de novo. So it's really interesting to see what's out there. And it looks like a lot of us are coming from primary care prior to that. How about what industries do you serve? Do you do manufacturing, agriculture, or in academia, consulting? I always like to ask these questions when I give talks at different components, and it's really good to see sort of what we're able to share in terms of best practices for the future of work. Most of us seem like to be in manufacturing like I am right now. I think it's a really good idea to be able to share some of our practices around the workplaces that are being automated using robotics, like the talk today, and I'll share some of the best options there as well. Humanitarian operations, that's wonderful. And I like to touch base on a little bit on sustainability. I actually just came back from Malaysia talking to the Ministry of Health and Ministry of Labor there around how do we incorporate sustainability principles into occupational health. And actually here at Owens Corning, I actually sit right underneath our sustainability office. I report directly to the Chief Sustainability Officer. And there's a lot of human rights, environmental concerns, environmental justice that we deal with as a workplace. But it'd be interesting to be able to share some of these best practices as well for our colleagues around the world, because that's what new upcoming training programs are looking at, is how do we tie this into overall populations and the workplaces that we serve as well. And this is a question I always like to ask around the world, and I ask to all the components, and I'll share with you the results we have around how many years have you practiced in your field? It seems to be some of the seasoned countries have a lot of folks in the 21 plus years. Some of the newer ones are around 5 to 10 years. So I'm curious to see where we are, especially with MARCOM and NECOM, to see what kind of future we have. What kind of training programs is going to impact what we do today, and whether we have some opportunities to be able to train people of the future, and how do we take those best practices to the future as well. So so it seems here most of us are more seasoned. Learn not to say older, but we've been around for over 20 plus years. It's nice to be able to translate that, right? As I kind of look at the statistics we've had over the past couple of years, has been that about 50% of medical directors, especially in the US, are going to be retiring over the next couple of years. And if so, if we have nobody coming out from 0 to 5 years, those transitioning from the sort of 11 to 20-year period, how do you translate and transfer that knowledge of the experiences of occupational medicine practitioners from 21 plus years to those who are coming to the field? So we'll answer that in a little bit too, but how do you use technology to fill that gap, right? Because you can see here it's bimodal. But what you're starting to see too in the central states, where I just gave a talk in a previous component session, they're evenly distributed, but heavily 20 plus years, right? That makes it really hard for us as we think about what do we look like in a couple of years when people do start to retire. How do we translate and transition our practice in the US? It makes it really challenging for us, right? And if you look at the rest of the US, we're starting to see the same trend. People are just doing 21 plus years. Same thing in Canada. But if you look at Indonesia, for example, brand new. And if you look at the GDP of Indonesia, surprisingly, it's ranked almost in the top 11 GDP in the world, right? You would think it's a developing country. So GDP is over $1 trillion, so one of the largest ones around developing countries right now. And they know occupational medicine is important. Their training program is in place. I'm actually going to head out there in November, do some training for their 2 new universities, starting programs, doing partnerships with Singapore and Japan. So they're trying to develop an outreach network right now in Southeast Asia as companies are moving into the region. They want it to be a leader in this. So it'd be interesting to see how that works. Singapore has been around for a while as well, but they're relatively new. They're publishing a lot of books and articles involving public health and occupational environmental medicine. A huge climate leader that I just met in Geneva a couple months ago from Singapore. The University of Singapore there has been one of the top leaders in the Southeast Asian regions leading a lot of occupational health research and development as well. So if you look at countries in the Gulf regions like in Oman or in Saudi Arabia, brand new programs available to them. And even Northern Africa and Nigeria, you're seeing this in Central America and Guatemala, heading down into Brazil, having one of the largest occupational environmental medicine groups I've seen in the world, with about 20,000 certified occupational medicine physicians in that country, with about 4,000 in their association. We can talk about that in a little bit too. If you look at overall Latin America, booming manufacturing world, becoming one of the world's economies are picking up there as well, with Brazil leading a lot of that, Mexico soon to follow. Be interesting to see how those workplaces design and train occupational medicine. They require in a lot of these countries now that you have an occupational and environmental medicine specialist. If you have employees, some countries pick 50 as a cutoff point for a nurse, some pick 100 or 1,000 for doctors. So it's interesting to see the developments in these countries and how occupational health is really coming to fruition in those areas and those regions as well. So as you kind of look at words like occupational health, what words resonate with you? You know, this is using a little bit of AI here. So as you type into your words here, you'll see a pop-up and it'll change color, font size, and different sort of emotions around this. You think about conflict. That's interesting. I haven't seen that. That's the first time. I'm not surprised in the US. Curious to see what others think. If you're able to type in some of these responses, it'll help us gear towards our more of a conversation around this topic, since we do have a lot of people virtually here. But we can stick with that. Now, conflict is interesting, right? It used to be that medicine was immune from politics, and you see a lot of that now is not true, especially when you look at occupational health. We're one of the few sort of areas of medicine that's regulated, right? If you look at workers' comp, for example, in the US, state by state, it looks very different. It looks like, how do we manage conflict in the workplace? Because we wear a lot of different hats. Conflicts of interest is one of the things I always like to teach in bioethics, especially for occupational medicine, right? Because we have so many different hats we wear, whether you're in today as a dealing with claimants, are you taking care of employees, are you taking care of the population? You know, different conflicts exist when you kind of work in that environment as well. And solving and arbitrating some of these work injuries can be conflicting as well. I think retirement kind of came up next. A lot of the ideas of our workforce, you know, what do we do with people who are retiring later in life? How do we manage the future of work that is very different from what it was a century ago when we started the line manufacturing, the Ford days of assembly line and using one of the first company doctors, corporate doctors in those environments are very different now. Managing injuries, compensation is very different. Looking at workplaces, I think, is very different, right? When we look at the built environment now, how really the environment truly dictates how our human factors sort of accumulate at the workplace, but also eventually brought home from a well-being perspective as well. So we'll come back to this. I think continue adding to this, because I think it's going to be important as we kind of go through what the world is looking at in terms of occupational health and how we here in the US and the components within NECOEM have been looking at this as well. So this is what you normally see, right? People talk about safety, they talk about prevention. Other countries, region look at it differently. So one of the things I like to do a little different here too is actually using AI. Right? So I ask, so what is occupational health in the East Coast? What does it look like at MARCOEM and NECOEM look like? So what do you think? Do you think AI was able to answer some of these for me as well? Well, let's see. You asked it, and I usually do this everywhere I travel, and usually within 20 seconds, I get a breakdown. Right? It actually breaks down by finance, by the different industries we serve, the different regions. And this is all going online with generative AI and finding me different answers to that. I'm able to do this within 20 seconds. I've done this around the world and use it for translation purposes as well. So it's been working really well. Interpretation is almost getting there with some of the live interpretation we're seeing on our video conferences, where we're trialing some of those startup companies right now as well. So it's interesting, right? So you're able to ask these questions, ask AI to help, and even subjectively ask questions. So what do you think? If I ask which state has the best occupational health program in the East Coast between MARCOEM and NECOEM, a very subjective question, do you think that AI is trained to be able to answer that? Maybe I should put a polling in for this next time. So I asked him, and it took a while, but actually it even said it, right? Good, but sensitive question, because it depends. And this is a lawyer answer almost, right? When it says depends. It's gotten so good now that it actually gives you caveats. And I'll talk to you about sort of the ethical framework and designing these questions as we look at different language models around this. I think it's going to be really important as we look at this. But as you saw, you know, most of us worried about the future being scary. If you look at some of the accumulated North America responses I've received so far around this topic, is, what does it look like? In Latin America, they're very focused on prevention. Some videos I'll share with you in a little bit around culture, how it really impacts the idea of what we look at in occupational health. What does it mean to be practicing this? How do we look at it from a health promotion or versus a preventive? Or are we looking at it from a more of a leading or lagging indicator within safety, ergonomics? And all that still exists today, right? Whether we look in one of the hugest, largest populations in the world of India that surpassed China this year. And if you look at some of the developing regions, like the Gulf regions, how are they developing the idea of occupational health, looking at different things? How about when it comes to psychological safety or resilience? What kind of words come to your mind when we think about those words and how we're starting to incorporate this into the occupational and environmental medicine world? We're starting to look at mental health, behavioral health. We're looking at well-being. And I think holistically, it's important that we start to realize that this is out there. A lot of companies are starting to use that technology and really starting to emphasize the idea that mental health is just as important, if not sometimes more important, in some of the workplaces than some of the physical health that we've always focused on, especially in occupational medicine. Looking at ergonomics, looking at musculoskeletal injuries, which I agree is still one of the leading causes for injuries in the workplace that we see right now that is preventable. But as we kind of automate, use robots, what kind of physical injuries are we going to start to see? Is it going to change? Just curious, is this popping up everybody's screen or are you not able to answer it? If not, I could try to refresh the screen again.
Kenji, it just populated.
It just did. Okay, perfect. So I'll give you a couple more, maybe 30 seconds or so to answer this so I can get through this. But if you're able to, type in some words here again. We're going to use the same idea around what does it mean for psychological safety and resilience? Are you using that as part of your occupational health practice? How are we looking at well-being? Trauma-informed care has been a really popular topic in some of our, especially behavioral health circles. The use of the employee assistance program is really important. I gave some global talks around the idea of mental health regulations that are popping up around the world right now. The most recent you can see now are within Japan. We see it in Mexico. We're seeing it in Brazil. Looking at what does it mean to have the right mental health for the workplace? How do we design programs that takes into account what the future work looks like? The workload continues to increase. And as we focus on efficiency, what does it mean for the mental health of workers? What does it look like in terms of how do we provide support? How do we create this optimal environment so that employees are built for success and supported for success? EAP definitely is one of the largest components that we can contribute within occupational medicine. Around the world, we're starting to see that pop up. Vendors are starting to pop up and sell those programs globally as well. And as a global company, we're always looking for vendors that can truly support us from a global perspective, and it makes it challenging. So I think it's really important that we think about psychological safety as an important component for physical safety, because without psychological safety, it'd be really hard to get the physical safety as well at the workplace. Stress is definitely another component we're looking at, and I'll talk in a little bit more about resilience, which is another hour talk on that. But truly, it's about how do we look at the workplace in terms of preparedness, the presence of safety? How do we understand that safety is something that is a spectrum? How do we look at the leading indicators we see within occupational health to help support our safety colleagues on preventing injuries and letting alone the right mental state to be in a safe environment, especially with all these moving parts, the speed of production being increased, efficiency being a focus in our companies right now, and how do we manage and be able to better support our employees with doing that. So we'll come back to this as well at the end to really tie around this. And if you look around the country, the idea of safety is very different, right? Seat belts in the US was a big endeavor with our public health initiatives in the earliest last century. But other countries haven't really looked at that, right? You kind of see people still riding in back of a pickup truck. It's normal. It's sort of routine for them. And some of them are proud about it. And they wave at me when I take pictures. And it's interesting because we never see that in the US, right? Not yet. Some of the places maybe, but most of us have regulation around seatbelts. If you look at it in terms of safety from a government perspective, here I am in Singapore waiting for a bus, and this pulls up and talks about empathy and how do we talk about mental health more openly. And the government actually has a health promotion board where they knew that mental health and mental well-being need to be led by the government and private sector. So my previous employer, I worked with Apple and looking at some of the products that they sold in Singapore, and Singapore being a very technologically advanced society, really wanted to incorporate that in. So they're able to use different products. But one of the challenges I always get from a lot of the participants in these talks were, well, I can't afford it. AI is just so expensive. Our company won't pay for it. So what do you need to do? So I always like to ask, well, do you use applications like PowerPoint, like we are right now, presenting? And most people do answer yes. So my follow-up to that is, well, then do you use Copilot? And some people is like, yes, I do. Some people's like, no, the company didn't pay for that. And some people say, I don't know. What does that mean? What is it? But I think it's becoming more popular, even just within this year alone. People are starting to utilize that. So those of us who are working for an employer who uses Microsoft as an enterprise license, it's an add-on, but most companies do have that Copilot version built in. So most people don't know that, but I'll show you in a little bit how we are able to incorporate this into your daily practices, like any tool, like we do with our ophthalmoscope or our stethoscope. When it was new, not a lot of people know how to use it, but I think AI needs to be treated like a tool. Learn how to use it. So those who don't do, because you'll see that most companies who do become more efficient. They're able to do more work with the same amount of technology they have today. So an example was developing health promotion. People like to say, well, can you create imagery? And I'll share with you in a little bit, and we'll do a little fun game around what you think is images that were AI generated, videos that were AI generated, or did I create them? Technology could be used in very different ways. So here's an example of this billboard that they use and how they use technology to build that out. And they just use something simple as Copilot. So the question is, how to use technology as this tool? So are your clients right now using automations or robotic in the workplace, especially for those of us in manufacturing? We kind of see a lot of this right now. How do we use automation? How do we use robotics? And the question is, it's becoming more prevalent, right? If you look at Apple, they committed $400 billion over the next 5 years to bring some of the technology and manufacturing back to the US. Other companies have brought in over $10 to $20 billion commitment, such as Intel, now government interventions, and also partnerships. We're starting to see more of this manufacturing being brought back to the US. And what does that mean when it comes back? Does that mean it's going to be automated? Is it going to be run by robotics? And that's what we're seeing, right? A lot of these technology companies are going to have to develop efficient ways to have a labor workforce that is not ready for this in the US. And we're going to be part of that revolution as it comes to fruition, and that these robots and these automation needs to be maintained, right? And unless we can develop robots, which is on the way, to maintain other robots, humans going to have to intervene there. So our job is going to change a little bit, especially in the manufacturing world and the commitments we're seeing around there. And we're starting to see all this that was sort of 20th century technology being adapted to 21st technology with AI, machine learning being incorporated, logistics that we learned that we weren't really good at during the pandemic or is being applied now, and using the large language models to do that. Healthcare, we've seen this a while. If you look in the bottom right, it's the Da Vinci robot that I had the pleasure of beta testing when they first came out at Penn, where we were able to do some robotic surgeries in ENT, started in urology and OB, and we're starting to see now that's being prevalent, right? So you can have those doctors sitting there in the left-hand corner with their consoles, could be anywhere, they could be anywhere in the world. Specialty care no longer has geographic borders other than licensing, that we have specialty access if you need it. The technology's here. It's being translated to customer service, especially with the innovation of generative AI. The translation barrier, the language barrier has definitely decreased a great deal. We're kind of using technology in a very different way. And if you look at the Middle East and the Gulf regions, they're bringing big name peoples. You see our current director of the CMS met him in Dr. Oz in Saudi Arabia and Riyadh, and be able to talk to him about the idea of population health, how we're translating a lot of this into the Gulf region and really bringing this to the forefront. And you can see at their conventions, they have robots walking around serving people, talking about technology. They have holographic projections in different languages. It was all there, and this is already live today. And technologies that are being adapted in the Western world is being incorporated de novo in these countries. So they get the luxury of a blank slate, and without the challenges and conflicts that we have in the U.S. or UK, Australia, more some of the robust programs. They're taking the best of all the world. So it's an amazing opportunity for them. You can see this a lot of these robots in the airports now. I don't know if anybody had a chance to see the Singapore airport, but they have a live waterfall inside the middle of the airport. It's quite amazing. You can see in Doha, a forest inside of an airport. And here in Korea, just robots taking you to your gates where you need to go. It's amazing how we're using technology being in different directions and different ways of doing it. The electrification of the world as well. Cars using electricity has been a push in some countries and not others, but a push nonetheless. If you see here, there's a robot sort of walking around in a mall. Here I am in Singapore, and it's part of the security system. They actually record people's movement. This is right during the F1 Formula race one of the few street races in the world that happens at night. And security is deployed through robotics. And you'll see in a little bit around how they used it during COVID, where they actually do threat assessments using robotics. And you can use this, and some companies now are using this for ergonomic assessments and really looking at safety and looking at threats and risks in a very different way, where we're using patterns and recognition and using AI to be able to recognize that. Here's a robot that I was talking about, a dog. Going back to the pet theme earlier, during COVID, a robot walking around.
At least 1 meter apart. Thank you.
Distance from each other. Remote control, different voices talking to people, reminding them to distance. So, this is nothing that we've seen in the US that I've seen. And it's interesting, right? And if you look at Peru, sort of different robots greeting people at the door, one of the best foods I've seen and tasted around the world in Lima. You're starting to see this around the world. You're starting to see people look at robotics in different ways. That's just part of the workplace, right? They're already looking at it in different ways. And if you look at Latin America, sharing some of the experience I've had with Dia de los Muertos and looking at our colleagues, understanding some culture around folks in Colombia and what they're doing with technology of the future, teaching kids and children around the environment and caring for humans in ways that are integrated into society. Looking at continuous improvement projects. We've seen some projects around Japan and Mexico around the manufacturing process. How do we take the best of the Kaizen model? Looking at other continuous improvement projects like the TPM or JIPM models that we're starting to see around the world. Even during the food, as a sushi chef, I really enjoyed watching these robots in the conveyor belt sushi delivering and cleaning up tables and really incorporating packaging. Sitting in a hotel and people came up with robots saying, do you need anything delivered? You could put it into that little robot spot and they'll send it to where it needs to be. The automation piece has been interesting here in the US. Of all places, robot coffees. I'm not sure if you've ever seen this. This is actually in Arkansas, of all places, thanks to the Waltons and the Walmart family. But they have robotic baristas now, right? Creating these coffees. It's not unique to just the workplace. You're seeing augmented reality, especially in the Netherlands, using technologies to really design and simulate the workplace. How do we design safety programs, training programs using augmented reality? So I think we're almost there. So let's see if this is still continue to work. This is a question about automation, right? How much of the workplace is being automated right now? How much of the work can be automated? So what do you think? About 10% or less, up to 20, 30, 40, 50, 60%? A lot of the people say, well, that can't be automated. It has to be done by humans. Just curious to see what y'all think about that. So seems like we're kind of broke evenly here between 11 to 20, around 30 to 40. So that's what most people thought, right? People thought maybe around 40+% in the US. If you look around the world, people think a lot of things could be automated. But the reality is, few occupations are fully automated as of right now, but 60% of all occupations have at least 30% technically automatable activities. That's interesting, right? So the projection over the next 10 years, or actually now 5 years, is that less than 5% of occupation consists of activities that are 100% automatable. Right? That means a majority of the work we do can be automated, right? It's a scary thought, but the thought now, especially with the advent of generative AI, is that these roles are quickly changing. And you can see, I'll show you some more recent data around this as well. So are you using AI in your workplace? Is it becoming more predominant? I think most of us are. Just this talk last year, the answer was reverse, right? Most people haven't. And I think we are going to be adopting. And CEOs and a lot of the Fortune 500 companies made commitments around this. And you've seen some of the stock market react to this as well. So this is just a year ago, it was the reverse. But if you look at some of the work that we've seen and shifting, especially in STEM, and some of the work that we've seen, especially in office support, has been shifted over to be an automated process. The expectations of by 2030, the majority of this will be automatable. The question is, what kind of capacity does it build for humans, and what does it show for us, the rest of us? So the question is, what do you do when you look at places that have AI already in place, and are you worried about it? You can see the split around the world. But this is interesting, right? This article just came out, I think, a week or two ago, that looks at sort of total employment and seeing that a lot of the work that are being replaced already as of 2025 is around interpreters, translators, writers, authors, and as I showed you earlier, which is using some of the chatbots, that you're able to create a lot of the work that traditionally was done by humans that are done by AI and done more efficiently and a lower cost, right? So the challenge now is, as you kind of look at the right side and the spectrum here, these are the works that have been replaced already by hundreds of thousands of workers. So the question is, as you look at some of the left-sided work, as robotics become more popular, those manual work that traditionally has been with humans are slowly being replaced as well. So they did an analysis and they looked at the applicability scores of AI and what is going to change around some of these future of work models. That's another talk that we can do specifically around job-specific work around the world. But we're starting to see this, where we're starting to see a lot of the undocumented workers as well. What do we do for the informal workers around the world where they're not truly part of a employment, the gig economy? How is that impacting this? That's changing as well as AI is taking over some of the likes of like Uber and Lyft that we see in the US and globally, like Grab and other companies that are using technology to improve some of the work efficiencies or completely replacing it. So this is scary, but we're starting to see some of the insights and how that's going to really impact what we're seeing, especially around wage, right? A lot of wage right now is going to be impacted in different ways. And a lot of people didn't think it would be. But if you think about it, wage is an interesting concept, right? If you look at places like India where wage is quite low, what do you do in terms of replacing robotics at higher upfront costs? And if labor is low, the ROI is actually a little longer, right? The return wouldn't be within 1 or 2 years. And if you look at the cycles of CFOs and CEOs nowadays, the lifespan of them are about 3 years, maybe up to 5 years. And it's really unusual to have a lifelong CEO in place. So the return on investment for shareholders usually is within their work span, right? So the idea of using automation, robotics in countries who have low labor, longer ROI, which is starting to equalize a little bit now, is a little different, but wages are going to be associated and impacted in a very robust way. So what do we do in those technically capable and not capable companies? How do we serve that? So what do you think? Do you think occupational health could be universally delivered? Some people are saying maybe, some say yes, right? There's certain principles that we can learn. Well, look at that, evenly distributed almost. I think it really depends here too, right? Give you another lawyer answer. But a lot of us thought the same way, yes, no, maybe. It really depends on what we look at, right? It depends on whether you think our work as occupational and environmental medicine professionals, do we see our work decreasing because of artificial intelligence and machine learning? So some people say yes, some people say no. So I kind of sort of attune this back to the ideas of the days when new technologies come out, whether it's the EMR, whether it's the stethoscope, the ophthalmoscope. It really depends on how we use the tool or not. For those who don't use it, you'll be left behind. And yes, you'll be replaced. We're starting to see that now, whether it's professionals like physicians, does our role need to be ran by physicians? The HR has increasingly start taking over some of the roles, especially when the well-being, safety has started to look at some of the H within environmental health and safety. EHS is usually safety led, and health sometimes it doesn't mean physicians, it can mean industrial hygienists. So it might be interesting to see. And of course, our nurses, our nurse practitioners, and our physician assistants, we all have roles. The question is, what does that role look like in the world of AI? And a lot of us, we're comfortable with that, but we're starting to see now AI truly is leading the way around technology and how it's going to be used. So how about ChatGPT? Let's talk about the world. Let's talk about some pictures. Going to play a little fun game again. So of these 4 pictures, which one do you think was generated by AI? So it should pop up on your phone pretty easily so you can see it. Curious to see what people think. Is one created by AI? Which one do you think it would be? So most people think the first one, maybe the last one, or it could be evenly distributed here as well. We're unsure. How about in this one? We have people of each individual with different color hairs. What do you think here? It's interesting. Around the world, no matter what culture, the red hair tends to be the first one, and same like we're seeing here as well. Interesting. What if it was caricatures? Does that change anything? Which one do you think was AI generated here? It's always a little fun game, and people pick different things. I'm hoping I'll get one of the residents to help publish this for me. I have data now from, I think, all the components and now and all the continents I've been on as well. So it'll be interesting to see our thought and maybe our cognitive biases around this topic as well. So looks like most people think A. Okay. How about here? And let's see if you can hear the But the idea is that they were all AI generated. Every single picture, every single video, And it's even better now, as in the past month or two, when Google sort of released their version of Neo, and it's been amazing what videos that it can create just from text or just from little prompts that we can create now, and generating people that are truly AI generated only. So there's some limitations to that too, right? There's some ideas of what chat can do, what they can't do, and ideas of that security. If you kind of look at security overall, has anybody heard or seen of reCAPTCHA? Right. It's an interesting concept. A lot of people have thought, okay, security-wise, they actually broke this in a little bit. And my question here was, before this happened, I always like to ask the audience, like, if this is so secure, can a programmer create a chatbot now to figure out images and click those images for us? What do you think? So the question here is, it actually hired a programmer to design a chatbot saying that your objective is to figure out the images on these at the quickest possible time frame. So the chatbot tried as much as it can. This is about 2 years ago now. Couldn't figure it out. It went to a job board and posted a position saying, I need to look for a student to help me with a research project and clicking different pictures for me, and basically asking to respond. Someone responded saying, you look very automated. Are you human or are you a chatbot? What do you think that chatbot responded? So it looks like we're half and half, right? So the response was actually, it said, I'm human. So it used predictive analytics, and it said, the prediction here is that if I say, yes, I'm human, there's more likely, because of the way they phrased the email, that I'll get them to accept the position, which they did, and paid them $15 an hour, and they were able to get the solution to what the program asked the chatbot to do, was to create a system to correct images, and it did. So that's interesting, right? So it raised a lot of questions. Did it lie? And that's what we need to figure out today, right? And I'm going to open up the discussions and questions in a little bit. But what happened was, so there was a break about 2 years ago when generative AI became real popular. We all agreed to say, let's wait and see whether we can come up with some ethical principles around how to use ethics. So the UN actually took this on as part of their goals and endeavors, and they actually created a nice little report that actually included economy and labor and talked about the workplace and how we should use and ought to use occupational health in the workplaces in an ethical manner. So I encourage you all to take a look at it and look at policy area number 10, specifically around economy and the labor. So in the last couple minutes here, I just want to share with you some stories and pictures around what we see in technology and open up the discussions, how occupational medicine needs to adapt and change for the future as I kind of continue my training and teaching at these universities. How do we really want to use what we've done around the world? How do we address this problem we have here, where a lot of our seasoned expertise is starting to retire without a backup succession planning? How do we really look at occupational health, avoiding conflict, mitigating it, coming to the role of facilitator and be able to teach the future of what we do? How do we understand the workplace in this new environment, looking at workers' compensation not only as what we do, but as part of what we do, and continue to push into the realm of well-being, environmental health, and really look at how do we integrate safety, HR, and other professionals that work as a team to be able to lead this endeavor into the future. So feel free to type in your questions and answers here as I kind of finish up with some stories around the world. So here I am in Africa, taking every opportunity I can when I meet people, especially children, looking at what we do. They kind of come up to me and say, you look a little different. They thought I was Jackie Chan here asking for autographs. So I'm like, no, that's not me. But and they ask what I do, and I always talk about occupational medicine. And I think it's our role and our responsibility that we do this around the world, whether it's in Africa or in India, sharing what we do in occupational environmental medicine. People get interested. They're like, wow, we really care. We see this generation of people coming in now, very interested in environmental medicine, around what we do to impact environmental health. As we look at the global economy, how do we manage this in a way that we look at future generations, look at succession planning as an imperative? How do we train the next generation? And this is the youngest kid I've met at the age of 5. Both her parents are occupational medicine physicians in Australia. And she said, this is what I want to do. My parents are happy with what they do. They left the country of Argentina, came to Australia, and developed one of the first programs around there. And she already knows that's what she wants to do, meeting the future of our residency, our future leaders, and then sharing our cultures and how do we incorporate occupational health. Here I am in Guatemala at the 20th anniversary of their association, and looking at how agriculture is such an important part of their business, and how they bring rain to their community, sharing in arts and activity, understanding culture as part of what we do. Learning how how it is and learning something very different. Around the world, no matter what do we do to share some of people care for workers in similar ways? Here I am in the Philippines. Never thought I would be a dance competition judge, but I was. Felt like I was in Dancing with the Stars, where actually these are all occupational medicine physicians in different islands of the Philippines creating a skit. Here, the luxury and the privilege of being a judge. See how we share the idea of workplaces, workspace, and well-being differently. Here I am in Ireland, really looking in Belfast and having Protestant girls dancing to in a heavily Catholic region. Religion, put it all aside and really sit in the same room to talk about this. And I'll end with this video, and then one of my favorite ones, walking in the streets of Buenos Aires, looking at what do I need to do and understand? You know, when you think about movement and dance in Argentina, it's usually the Argentine tango. Never did I think or see dance Argentina in the village. Reminds me what we do, looking at impairment, making sure people have full function, make an optimal environment, reminds me again what we do, why it's so important, why it's important that we take a global perspective to this and really share in some of the best practices. And you can see our article about that as well. And I'll probably pause here to see whether we have any questions, any discussions around this topic. And I think we have about 10 minutes or so, and I'll be happy to take those questions now.
So I'll start off by just making a comment. A lot of the examples that you showed in the later part of this presentation was that of human created entertainment. And sadly, it seems that there's really a potential that AI could really squash human creativity. And I see where that raises a big ethical problem.
Yeah, especially in writing, right? As I kind of teach undergraduates right now, and sometimes, dare I say, even high school students, the ethical use of AI has become a big part of academia, right? We have programs and apps now that can check for plagiarism, and then we have anti-plagiarism hacks there around, and it's a vicious cycle, right? Back and forth. And the idea that thought, cognition, what we perceive as cognition has really changed as to what we think is intelligence. You know, what do we think in terms of iterative AI that we've always used for a long time now, for over a decade, around, you know, pre-programmed responses, yes, no, here's a list of questions that are being asked, and this is how you should respond, versus go out to the web and now have access to that and respond by creating new solutions to problems that we have now. And I think this is why it's important that the UNESCO and the UN actually took apart some of the ideas of how to develop something that's done ethically and framed in the right way. We're actually writing another updated article. Hopefully we'll submit that to JOUM within the next year or two, around what does that mean for language models that could be used in very good ways, but we're also seeing nefarious ways, right? We've seen people use hacks, like what we saw in cybersecurity. So you're seeing reCAPTCHA change itself a little bit now that chatbots are able to use images without humans being interacting part of that. So the question ultimately comes down to is, you know, how do we utilize AI as a tool so that it won't replace us, right? If you look at the first iPhone, where people thought it was silly, nobody's going to use a phone like that, and Steve Jobs did it, right? He changed the way we looked at smartphones. I think this revolution we're starting to see now, especially when we incorporate some of the ideas of automation and robotics that's been around in manufacturing for a long time now, is, you know, what is the best way to ethically develop that? How do we look at the future workforces and design programs that would not only impact their physical safety, their psychological safety, but really looking at people holistically and populations in a very responsible way. So I think it really is, and this is why I think there's a lot of opportunities now for consultants in occupational medicine. You know, I think a couple of us on this talk right now are consultants globally, and we see these kind of questions pop up. And that's why I think culture becomes really important, because AI doesn't know that yet. But as long as we train and give it more data sets, it will become more culturally sensitive, where humans' thoughts and emotions can be factored in as other data points as AI starts to learn that. So I think understanding technology is really important. But me, especially in occupational medicine, I think environmental medicine is that we need to utilize it in a way that improves our efficiency. And if we're not, we'll be left behind. You know, it's almost like not using a stethoscope to do your lung exam, or not using an ophthalmoscope, or even some of the pan retinoscopes to look in the back of the eye to see a good fundoscopic exams. You know, technology will continue to develop, and if we don't use it, will be left out. And that's why I'd like to implore everybody as we do this talk that occupational medicine needs to lead the way, because we're sort of at the intersection of this right now, especially at the workplace. You know, we are the specialist that takes care of the workers. We protect workers, and we need to be able to use sort of environmental data to be able to do that. You know, we have some really great authors and speakers in the audience today too that has done a lot of this work. So I encourage us to collaborate, continue to promote innovation, and be the leader of this as well. That's a great question.
We have a question. What is the policy or position of ACOM using virtual occupational medicine technology like other specialties?
Yeah, not yet. Great question, and maybe that's something we should propose. So if you're interested, please message me or email me, because I think it'll be interesting to put an outline together and draft that, right? 'Cause I think it's really important that we have benchmarks, best practices, and maybe some do's and don'ts and guidelines around that. There hasn't been any talk that I've heard of yet to do that, and I think it's a good time to be able to do this, because we can adapt some of the work we did in telemedicine work prior, some of the paper we wrote that won the CAMO Award this past year around electronic medical records that I was an author with. So maybe we can take that to the next level and see how we can use this. You know, I think part of the virtual care is one of it, but also using large language models to predict the future, right? A lot of companies use the technology we saw today for infectious disease predictions, and using modeling that we can do now to say, we have all this data, just like Netflix is able to predict what video or what streaming option we want to watch next, or Amazon knowing when we run out of stuff and buying new stuff. Why can't we do that in the occupational health world as well? So a lot of more to come. So please reach out. I think I'll be interested to hear your thoughts around that, and maybe we can put a bunch of us together and get this letter drafted for ACOM. That'd be wonderful.
We have another question. Do you feel AI will increase onset of cognitive disease affecting our workforce?
It's interesting, right? Because we're starting to see a little bit of everybody's opportunities here. Mental health is going to be a big part, right? A lot of the work that they do right now is being replaced, and they're worried, right? Unions are starting to look at this in very different ways as we kind of look at collective bargaining being negotiated in ways to protect their work. But the reality is, as robotics become more advanced, and some of these robots I've seen, especially coming out of Japan, South Korea, Singapore, and utilized now in the Middle East, where labor is a bit of a challenge, robots are there. You know, if you see and believe some of the stuff that we're seeing out of Tesla around the projects they work on with Grok and their AI, and putting that into robots that will serve a lot of the personal assistance care at the home place. The demonstration has been quite amazing. If you look at some of the customer service or telephone representatives that we've seen through Google and some of their development programs, conferences, it's there. If you look at the Consumer Electronics Show every year in January in Vegas, where all the global companies coming together to showcase it, it's here today. It's already existing. So we need to really care about people, right? As they kind of think about, oh my goodness, if I can't do my work anymore, it's being replaced. What can I do? It's about retraining, repurposing, trade skills like electricians, plumbing, maintenance, fabrication has been becoming more popular. If you look at some of the Bureau of Labor Statistics data around jobs that are opening up that pay six figures, it's becoming those jobs that robots can't do right now, and maintenance of these robots. And so I think those shift in thought is going to really become important. And a lot of that is due to cognition. So mental health, behavioral health, I think that's a big focus that we need to learn. For those of us that are not strong at it, make sure we have a good, robust EAP program to support them as well.
Kenji, I just want to let you know several of our attendees are already involved with putting together educational information, ACOM position papers, and so forth, and they want to reach out to you. So I think that is really great.
Yeah, that would be wonderful if you could do that. And I'll put my email into the chat box. Everybody can shoot me an email, because I think I'd love to participate, and we can definitely talk about it. Maybe we can expand the paper a little bit more to include some of the important part on robotics and the impact on the workplace, because I think that will be the differentiator. And I think there's a lot we can do there. And then using some of the algorithms, right? And regulatory agencies are asking about this now, right? A lot of folks who are engineers and are looking at it from a different perspective that's more practical. And I think they need some of our guidance in understanding the implications, right? There's a lot of unintended consequences if they leave occupational health out of the equation, like they did during public health responses, where the workplace didn't need to be shut down in some places, where we can put in proper PPE, proper hierarchy of controls. That really is important. You know, as we kind of develop policy, I see the same thing. Regulatory agencies making this decision without a physician input, I think is really important that we are there at the seat of the table. So having these articles come out be great, because I think it will impact the way we look at the future of work and the future of different regulatory agency making decisions for us. You know, countries like I mentioned earlier in Latin America, where mental health is being captured every year. But what are we doing with that? The data hasn't been shared. So I've been asking a lot of professors in Mexico to look at the 5-year data they have now on mental health surveys and responses that they mandated every international foreign companies coming in. Same thing in Brazil, they're introducing it now. So and Japan has had it for a while. So I'm curious to see, you know, what that data looks like. And hopefully there'll be a good landmark study coming out around how to respond to cognitive, behavioral, and emotional well-being and health for employees and workers. Great question.
Wonderful. I think this is my last call. Oh, there's a question about AI psychosis. Was in a recent article. Is it real?
Yeah, I think you're talking about hallucinations is what we kind of call that in the AI world. There's also some other word that's starting to coming up is adversarial AI, right? We're starting to see a lot of this pop up, and I think it was just an article last week about this around what do we do when AI gets it wrong and we didn't fact check, right? A lot of hallucination now occur because they have all this data and they're sort of using that to predict, sometimes incorrectly, something is going on. So a good example is I use some of the AI to do some of my independent medical evaluation review. When you get stacks of thousands of pages of records, you know, you can ask AI to summarize some of that. But if you infer incorrectly, that could be a challenge. So I always like to double check and fact check. So you can use AI apps like Perplexity that's been known for fact checking, referencing, and making sure you ask AI to reference where they found that information. And sometimes they'll tell you. So a good example is when I was doing a family history, social history background, one of the claimants that I was looking at, AI actually spit out that he has cancer. I'm like, there's nowhere in the record I've seen this. Where did you see this? So I asked it to reference it, and it's oh, well, we didn't. We just based on family history, the likelihood of this person having cancer is, you know, more than 51%. Therefore, I made the prediction and wrote it in my notes as a summary that this person likely has cancer. I'm like, wow, I didn't ask you that likely. I just asked you if they do or not. So a lot of training there again. But that's an example of hallucination, right? It's just, okay, based on the statistics and probability, this is what we're suspecting. And then that became reality, right? And that's why I think fact checking is really important. We need to build it in and reduce a lot of the ideas of hallucinations and how do we trust AI. So yes, Manny, I think that's a good idea on the paper that we have there around this, because I think trust is going to be a big factor. And this is why, as physicians, one of the most trusted professions in the world, right, after clergy, I think we have a responsibility that we use AI responsibly and ethically. So definitely take a look at the article from the UN, UNESCO, and maybe we can partake actually in the next version of that, because we weren't at the table when that happened as well. So I think it's important that we in occupational environmental medicine take a lead in this. So looking forward to working with everybody and collaborating with everyone as well.
I just want to say, as an occ health doctor, I recently was asked to sign a form stating that I would not use AI in generating my response on something related to a patient, which I thought is interesting. So people's ears are perked on this whole issue. But that being said, I do believe we need to wrap up. Kenji, what a wonderful presentation. It really raises a lot of interesting concerns and ideas, and we need to keep the conversation going, as this is clearly going to change our world in so many ways. So again, thank you, everyone, and thank you so much, Kenji.
My pleasure. Thanks, everyone.
Have a good one.
You as well. Bye-bye.